By the time she got home, she had an email with permission with a visit summary, and she was shocked.
You're not looking at the person's eyes. You're not looking face to face. You're focused more on typing, not making typing errors.
She's like, did you send me a summary of our conversation? I'm like, yes, I did. In the past, it might have taken me 2 days to catch up with that note. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Most patients assume that when their doctor is typing during a visit, that doctor is distracted. But what if technology could actually allow physicians to spend more time listening, more time thinking, and more time focusing on you as a person? Today, I want to pull back the curtain on something we use inside modern primary care that many patients do not know about: an AI medical scribe. These tools are helping physicians reduce burnout, improve documentation accuracy, and most importantly, allow us to be more present with our patients. Let's talk about how this technology works and why it may quietly improve your healthcare experience. To take a deep dive into this, I brought one of my colleagues, an expert in primary care, Dr. Joan Ngembus, so we can talk about a tool that has revolutionized the way we practice medicine. Dr. Joan, welcome to the show again.
Thank you very much, Dr. Takem.
Let's talk about AI scribes. But before we do, let me share your story. I had a patient, now this was about a month ago, and after getting, of course, consent for AI scribe, we went through her visit. Then she left the office. And by the time she got home, she had an email with permission with a visit summary. And she was shocked. So she called back and asked to speak to me. So I called her after hours. She's like, did you send me a summary of our conversation? I'm like, yes, I did. She's like, oh, thank you so much. Because after I left the office, I'd completely forgotten everything you said. We made some changes to our medications. And she was so happy. And it made me reflect that, wow, in the past, it might have taken me 2 days to catch up with that note and then eventually send her a summary. In the meantime, she would have probably called the office back a couple of times trying to speak to me to get clarification on my instructions. So this led me to want to talk to you about the power of AI scribes and how it's helping us be better clinicians.
So that's a really good aspect nowadays, computerized system. It's what is out there nowadays. Back in the days, probably you would know it better. People were using the paper charts and, typing, trying to make
I'm
notes.
not that old. But that's fine.
I'm just saying, maybe you experienced it. But
I did experience the era of paper charts.
Yes.
I did.
Yeah. So I feel a doctor relationship should be a one where you are having a communication. It's like a discussion that is going on. And I think you spending your time, you're not looking at the person's eyes. You're not looking face to face. You're focused more on typing, not making typing errors. It distracts the reason behind me seeing a doctor to have that communication. So if I want to have an easy communication with my patient, which is face to face, you know that I'm understanding you. I am more focused on you. I'm paying attention to you while I go through my thought process about your symptoms, about what you're telling me. Now, for me, I think like it's a hell trying to, type, make sure that I'm noting the things that we are discussing at the same time. I lose that
the human connection
when I'm talking to patient. I don't feel that's the best way. Now, thank God to AI Scribe, what it does is it takes summary of what we are saying. So it doesn't write like a detail from every word that we say, but it summarizes our communication, right? And it says patient was advised, take blood pressure medication. For example, lisinopril 2 times a day, right? They put the milligrams there. And at the end of the visit, the note is already summarized for that patient to go and say, oh, that's a detailed summary. I can pick it up and I know what my doctor expected from me. And I feel that helps more to build a patient-doctor relationship than me focusing on typing and writing and losing that trust in our discussion. And I think it's a very helpful tool nowadays because it makes doctor more efficient. I do not need to stay more and say, hey, I need to do more paperwork, rather than me addressing to patients who might be calling after hours to say, doctor, you know what? I have a cough for 2 days now. It's not getting better. Let me call you at 8 o'clock. Meanwhile, I'll be like, I don't want to do calls anymore because at 8 o'clock, I have paper chats to do. So it provides me more time to be for my patient even after hours because I was able to complete a whole bunch of my work while I was seeing my patients. So I think the AI scribe is something really good for the patient and for the provider.
And that reduces burnout for the physician.
Exactly.
Makes him happier.
Yes.
And a happier physician makes happier patients. It's like happy wife, happy marriage.
Exactly.
Right? Happy doctor, happy relationship, happy patient.
That's right.
Awesome. How about privacy concerns that patients have? How is their data stored? And is there a process to destroy the data and not store it indefinitely?
Sure, yes. The data is usually stored for 30 days and then it is destroyed indefinitely. So I can't go back after 30 days to figure out what was there, which is a good thing, which is secure then for the patient to know that at least it was for that visit. And for the way we do the data, we don't put all of the patient's identity in the note, right? Yes. It could be just your first name and that's it. Yeah. Now, any third-party person who wants to pick out that information will not be able to attribute the first name to what date of birth, to what last name.
And there is no date of birth?
There's no date of birth.
There is no social security numbers?
No phone number, no address over there. So there are
pretty much no identifiers?
No identifiers, right? For us, it's just the one thing that we might be saying your first name or maybe your last name, but nothing else that could really identify to a particular patient to say this information pertains to this patient. It's for us, the provider, to be able to do that when we transfer the note.
Okay. And these are HIPAA compliant resources that have been validated by HIPAA.
Yeah.
And so we only use them because they are HIPAA compliant.
Exactly.
And how about the doctors who are afraid to use AI for whatever reason? What do you have to say to those colleagues?
Well, to them, I would say kudos to them for trying not to use it. But at the same time, I've used both systems and I know that my patient satisfaction or satisfaction from patients with my interactions with my patients is much better without me typing. So the AI has made life better for me and the patient satisfaction is much better. The wait times is better because then you're faster in your workflow. So patients don't get to wait too much time in the waiting room because you are trying to finish up the chart for one patient while there before seeing the next patient. So I think it's going to improve workflow and I think it's the best way to go. I would say to them, just give it a try and see what happens.
Yes, because we've noticed that it's improved our efficiency.
Yes.
And improved efficiency translates directly into better patient care.
Exactly.
Because we get to their things faster, we get to their documentation faster, get to their work excuses faster, their needs are met faster, and so patients are overall happier.
That's right.
I think we just as a healthcare system have to explain to patients why AI scribes are important, how it benefits their overall care, and the safety that comes with these systems.
That's right.
So I think a lot of the resistance is really due to a lack of proper knowledge and also like a physician blanket resistance changes, which we know it's a problem with us doctors. And another thing is we always ask the patient's permission.
Exactly.
Before we turn on the scribe.
Yeah.
Okay. So we really do not have any patient concerns here. And so just to wrap up, you just mentioned that the AI scribe is really beneficial because it has improved outcomes for our patients. Patient satisfaction is higher. Patients get their documentation faster. Patients get instructions for medication changes we made also faster and better.
Yeah.
So overall, it's been a very useful tool for us.
Yes, it is.
And that, as always, is the essence of being a patient ally in these complex times.
Yeah.
Right. Thank you, Dr. Joan.
Thank you very much for having me here.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.